It is 1 o'clock here on the East Coast, and the Beatles have just ended us at the perfect time. So we will go ahead and get started. My name is Brittany. I'm the training manager here at CADCA, and welcome to our February webinar Wednesday. That is a mouthful. We are so excited to have with us today Ms. Yvonne Stroman, who is one of our master trainers with our youth leadership program. We're so excited to have her today. She's going to be talking about partnering with the recovery community in the name of prevention. Just a couple of housekeeping things before I hand it over to Yvonne. We will be recording the webinar today, and the recording and the PowerPoint will be available on the CADCA Webinar Wednesday series page, so you can share it with other coworkers maybe who weren't able to join, or anyone else in your coalition. There will be an evaluation at the end, and then after you complete the evaluation, you will be able to receive your letter of attendance. That letter is only for those who participate in the webinar live. So please make sure that you complete the evaluation at the end of the day, or at the end of the webinar. And then just a reminder that if you're sharing items in the chat, if you're sharing feedback or providing commentary, please make sure to select everyone so that the entire group can see. With that, I will hand it over to Yvonne and let her take it away.
Why, thank you, Brittany. Glad to be here this afternoon. And for the record, it is sunny here in Pennsylvania, Reading, Pennsylvania specifically. And so I am just really glad to be here with you all. I'm going to bring up my screen and invite us all to kind of have a conversation, if you will. I know that it's a webinar, and so you might be thinking, how can we have a conversation? But that's the virtue, that's the benefit and value of the chat box and the Q&A, that I hope that you will all kind of join in and share some thoughts as we have this conversation this afternoon about engaging specialized populations and how the recovery community can really partner with your coalition as it relates to prevention. And I've done this presentation, I was sharing with Brittany, probably about 4 years ago. And that's when we were at the CADCA Leadership Forum in person. And there was an opportunity for individuals to really kind of elevate their thinking about, as we engage, about how do we build capacity among our coalitions, who is in our community that can perhaps work aside of us to make an impact. So that's what I really hope that we can kind of think about today as we move through these next series of slides. And as Brittany said, I am a trainer for CADCA, have been for probably about 10 years now, mainly on the youth leadership side. From time to time, I'm able to come before adults, whether it's a fee for service or in this instance, a webinar, just to kind of share a little bit of my expertise as it relates to prevention. And then from time to time, we have to talk about the other aspects of the continuum of care as it relates to treatment and recovery. So I have a master's degree in human services with an emphasis on addiction and recovery. And in Pennsylvania, we have what is called a certified recovery specialist. And so I have been through the Pennsylvania Certification Board for the last 5 years, been a certified recovery specialist. My experience in human services or social services has been more than a quarter of a decade, so I'm kind of dating myself, but worked in the area of with youth as well as adult and families in different facets, whether it was domestic violence or juvenile delinquency. And then I also was a drug-free communities coordinator for about 10 years at a local nonprofit that had a drug-free communities grant. And then I also, as part of my community, served on several local boards and committees, served on our local school board, as well as our law enforcement, our police diversity board, also was part of the Fire Civil Service Board. I now am on the advisory committee for mental health and developmental disabilities, as well as our suicide prevention task force and our opioid coalition. Day to day, I work with our county's drug and alcohol division for the county. And so I just feel that I'm blessed to be able to work in the field that I have chosen, or somehow it's kind of chosen me in many respects. But just want to share some information with you that I hope that you will be enlightened to hear, as well as kind of those aha moments that you're able to write them down or ask questions and take them back to your local coalition board and really have these courageous conversations about meaningful capacity building. To the left there, you see a picture of me. I love bike riding. I think that bike riding allows us to be, there's a certain level of freedom that I find with bike riding. Not only do I have an opportunity to pick which streets and trails that I can go on, but I also then have an opportunity to really kind of let the mind breathe. And when I let my mind breathe, ladies and gentlemen, it really opens me up to think about what are some ways that I can really be of value to the community so that I can make the greatest impact. Working with coalitions and communities across the United States, there are folks like yourself that have a lot of value, that have a lot of intel in terms of information. And then how do we collaborate and bring that together so that we can make the best innovative practices come to life, along with evidence-based approaches, so that our communities can be healthy and drug-free. And so I long for those sunny days. I know some of you talked about where you're from, and you mentioned 66 degrees and sunny, and I just can't wait for those sunny days to come back to Pennsylvania so that I can hit the trails. I also just like to say, as part of our webinar today, that I am a CADCA trainer, but I also recognize that as a CADCA trainer, there is a modality and approach to how CADCA trains. CADCA trains every day, but also there is some information that I will have that's outside of the perspective of prevention. And I really kind of want to have us think about, when we think about prevention, what does that mean for us? Not only what does that mean for us individually, but then how does that translate in terms of the work that we do at the coalition level, and then even within our community? And so I share that to say that I want to help us think outside of the box a little bit. And so traditionally, we are thinking about prevention and the means of primary prevention, but I also wanted us to think about in the way of outside of the box to include the value of the recovery community as a specialized population can bring to the table as well. And so that's what I mean when I say kind of the values and the ideals are not necessarily owned by CADCA, but they can be representative outside of the work that we do in prevention. So where are we going to go today is to have a conversation about how do we strengthen the capacity of our coalitions. And so I know many of you, all of you may very well be recipients of the Drug-Free Communities Grant. And we know that that's one of the charges, that if you're going to apply for a drug-free communities, you have to be concerned about capacity building. And then there are sectors, and we'll talk about them for a little bit, but then how do we make sure that we have full representation of our community at our table? And so in doing so, perhaps asking you to think about, is there an opportunity, if you haven't already done so, identify those mutual aid or recovery support groups that exist in our communities. And I'm using this terminology, mutual aid or recovery support groups, and they're very well might be termed something different in your community. So for purposes of our conversation today, I want to share with you what I mean by mutual aid and recovery support groups, as I'm referring to maybe 12-step help groups. And there's also groups that are outside of 12-step help that are called Smart Recovery or Refuge Recovery, Dharma Recovery, Celebrate Recovery. And so those are what I mean when I'm talking about those recovery-oriented support groups that are in existence. And then also identify how those meaningful roles, how the recovery community can really help impact the work of your coalition. And so how do we identify what meaningful role representatives of the recovery community can bring to our coalition so that it is impactful? And how do we begin to do that in the way of engaging them? So I just kind of like to open up this because I believe that when we can talk about the continuum of care, this model is probably not foreign to any of you, but if you look at it, oftentimes in the field of prevention, we're looking at prevention as its own pie. And even when we do the work in prevention, we're mainly talking about how do we embrace and implement universal strategies, because we want to impact the entire community. And we're really trying to prevent, reduce, or delay the onset of substance use and misuse among our young people. And we really try to, in our own special way, look at it from a universal prevention angle, right? But then I also want to ask you to consider that when you're looking at prevention, and what I like about the continuum of care is that it goes forward and it goes backwards to indicate that sometimes in that universal strategies that we have, we're not going to be able to address every young person, right? And so what happens from that is you have, if you take 100 youth, if you think about that, and you consider them to be universal, out of that 100 youth, say there's 30 of them that might be selective in terms of they might have had an initial experience, right? And so they become selective in the way of how do you provide information to them integrally and importantly enough that they then refute or refuse to continue to use. But then out of that 30, you might have 10 that are indicated in terms of they've already engaged in the problem behavior ongoing. When we say that, and then as it relates to that, you're then moving forward, then how do we help those 10 individuals in the way of treatment and then ultimately in recovery? The other thing that struck me about this picture, though, is that it seems as though when we're talking about prevention, it lands in its own lane, right? When they say stay in your lane, it lands in its own lane. And then so does treatment, because there's, again, evidence-based approaches as it relates to substance use treatment, and even evidence-based approach as it means in recovery as well. But we seldomly take this holistically to say, are we as a coalition operating in a continuum of care? And there might be some coalitions that choose to do that based on who's at the table. I've worked with a number of coalitions throughout the United States. And so some of them might have said, you know, we do have prevention, but we also have treatment and recovery at the table by virtue of the capacity building and those key stakeholders coming to the table to embrace the coalition work. This other thing that I will ask you to consider as well is that while prevention and recovery seem to be on the opposite spectrums, we also have to say that there's also common goals when we think about prevention and recovery. And I have several examples that I just kind of want to talk through to you and ask you to just kind of consider. Both prevention and recovery have the ideation that no one single approach is effective for change. I will talk about, and I mentioned about the recovery community, and that there are several different mutual aid support groups whereby an individual can find their sense of belonging and their sense of recovery. No longer is it, you know, years and years ago, it used to be, for the most part, solely Alcoholics Anonymous or Narcotics Anonymous. But what we've known in the 90s are there were other mutual aid support groups that come along to be just as beneficial. You know, when we talk about SMART recovery is another approach, so is Celebrate Recovery, so is Dharma Recovery. And even there are those that are, according to national recovery statistics, engaged in ongoing counseling as their mechanism of recovery, or even some type of exercise. So we know that there's no one single approach in recovery. And we also know that there's no one single approach for effective change in prevention, which is why we talk about the 7 strategies, right? Because what we understand is that through the 7 strategies is where we can make the greatest impact in terms of community level change. And then what we both know is that there's leadership development that can take place among the prevention schematic as well as the recovery scheme. And we also know that the community strengths and needs are included in the data collection. And more is data becoming valued and evident as it relates to how do we further the needs and the strategies in prevention, and how do we further the strategies and needs in the recovery community. I'll talk a little bit about later on how the recovery community over the years has really tried to find its niche within the realm of policy and advocacy and finding their voice. And all of those things are really among the prevention field and the recovery field alike. So there is another common goal. And they both educate and raise awareness about prevention, the value of prevention, as well as the value of recovery. And then they both address health equity and the need for access to meaningful prevention and meaningful recovery. They both use evidence-based approaches as a means to encourage wellness, and they both advocate for policy. So while they are on two separate parts of the continuum of care, they're not really as far apart as sometimes when we have conversations at the table that we seem. And we have a responsibility as coalition leaders to find out, to investigate a little bit more as it relates to our own community assessment. How valuable can the recovery community be in terms of our efforts in prevention? Because I will tell you that the recovery community is about change, and is a part of that change to be a value and an asset to the community versus being a liability. And I believe that prevention can be a part of that value to the community. So the other thought that I had, and part of this is in terms of some of the work that I do, is I'm always getting information, and like you, probably getting a lot of information from SAMHSA, just in the way of information that we can use to make decisions about the work that we do and about policy changes. But we also know that SAMHSA is kind of the purse string holder in the way of how it's looking at ways to improve services in the community. And so I was looking at the SAMHSA website and found this blog, which I found to be interesting for a couple different reasons. And this is by their Assistant Secretary of SAMHSA, Dr. Delphine Rittman. And she basically in that blog talked about what's happened as it relates to the opioid crisis. Last year, for the first time, opioid overdose deaths toppled 100,000 people dying from this, from using drugs. And she also talked about suicide, and suicide is among the top 10 deaths, fatalities that are happening across the United States. And so these things have been shown to be increasing over the years. And so throughout her blog, though, she also mentioned about prevention as well as recovery, and the need for communities to really look at how these entities can work closer together. And so I just kind of snippet a few of the comments that she made just for your consideration, if you would. One of the things she said, which I really kind of embraced, was recovery is an essential component of the prevention strategy and a cross-cutting principle throughout SAMHSA's policies and programs. And so it gave me that opportunity to think, aha, so here's an opportunity to say, if we're moving forward and as we look for additional funding, is there a place whereby we can try and coalesce recovery funding along with into our prevention strategies? And it's just a conversation, it's just a question, but I appreciated her comment about that, because in terms of policies and programs, there very well may be this forethought on SAMHSA's behalf down the road. As part of the work that I do here in Reading, Pennsylvania, I know our opioid coalition is aware of those opioid settlement dollars that is coming down the pipe. And what's happening for communities now, and you might want to look into this for your own community, is if your state is going to be the recipient of those settlement dollars, there's certain questions, or there's certain requests, or there's certain things that they're expecting to happen with those settlement dollars. Prevention being one of them, but so is recovery. And so is this an opportunity to begin to find out just what are going to be some of those requirements and benchmarks for these dollars to come into our communities? And then how can we begin to have those conversations around what makes the best sense? How do we share intel? How do we share information? How do we share data so that we can move forward in a way to be ready for when those dollars come into our communities? The other thing that she says is prevention and recovery services operate under the behavioral health umbrella, right? They share common goals. They have distinct sets of services funded through separate sources and address social determinants of health. And what I got from that was there may be separated funding, but it doesn't mean that we can't still play in the same sandbox, if you will, because they're all under the umbrella of behavioral health. And also she goes on to say, to build community resilience, there is a tremendous potential to work together in a coordinated and comprehensive manner. So the coordination and the comprehensive manner, again, as we think about those comprehensive strategies to make a difference in our community under the guise of prevention, wherein can the recovery services come into consideration? And then one of the other things that she said is the prevention and recovery services are critical elements of a health safety net for our communities. She goes on to say our mutually reinforcing activities enable us to work collectively and coordinate as a cohesive system to create hope, build resilience, and strengthen our communities. And so if you have an opportunity to Google her blog, that's the title of it, Building Community Resilience, Prevention and Recovery Services Working Together. And it was dated in November, this past November of 2021. And so I plant these seeds just to say that this is coming out of SAMHSA, and this is their strategic thinking as it relates to prevention and recovery. And if that's their strategic thinking, why not in the work that we do as it relates to coalition and capacity building, maybe there's an opportunity to have a conversation around that, around this thought and this theory and this practice as well. And so just as we go through and move through these next several slides, I'm hoping that some of this is kind of aha moments for you as it was for me. And so you know, we're all drug-free. I'm assuming, I'm making that leap to assume that everyone, if we're not drug-free communities, that we're vying for those drug-free community dollars. And as such, we know that there is a requirement, right? As part of establishing and strengthening collaboration among communities, what ONDCP is saying is that these are the critical entities that we must have around the table. Parents and youth, and I'm not going to read them all because you know them, but I would dare say when we talk about specialized populations and we talk about the recovery community, they could be under the umbrella of civic and volunteer organizations because, you know, they come together wanting to support one another, but many times, you know, it's within the civic realm in which they operate in terms of their own recovery. And so we think about that. The other thing I also want to share with you, and we can get into later, how can we have those conversations about bringing them out, is when I talk about folks in recovery, they could be in any one of those entities. And so how do we know that? What are some of the things that we can embrace as a coalition to say we really need the recovery community represented, and how do we go about doing that? How do we go about bringing out recovery out loud, if you will, so that people feel comfortable around the table? Because we'll talk about history a little bit later on in terms of a challenge, but how can we move around that challenge or reverse that challenge so that the recovery community feels embraced and appreciated? And as I talk about recovery, I just kind of want to begin the opportunity to talk about our great United States of America. And what we basically, and this just comes out of the United States Census, is that last there was, and I think this was from 2020, there are 328 million Americans in the United States right now. I share that to say with you that 23 or 22 million, and it depends on which data set you look at, which is the importance of data. I've seen data talking about 23 million, but in this instance, in this graphic, according to the National Recovery Survey, that there are 22.35 million Americans who have resolved their alcohol and or drug problem. And that's about 9% of the United States population. And as I did my math, I'm no mathematician by any stretch of the imagination, but I took a look at the top 10 largest populated cities in the United States. And when you talk about 22.35 million Americans, that's actually the top 9 most populous cities in the United States. So you think about the top 9 most populous cities in the United States, that's the number, that's the sample that represents the number of folks that are in long-term recovery. The other thing I'll say about the National Recovery Survey is that they survey individuals aged 18 and over. And so we can't dismiss, since oftentimes in prevention, we're talking about young people. And if you were at the CADCA National Leadership Forum a couple of weeks ago, when there was a young man that spoke, he was 16 years old, and he identified himself as being in long-term recovery. So I say this number, I submit to you this number of 22.35 million may actually be larger if we include young people under the age of 25, under the age of 18. And then it just goes on to kind of share with you, they're in recovery, and what are they in recovery from in terms of alcohol or cannabis or cocaine. And also it gives you also just a sampling of who they interviewed and who they asked in that sample. And so I just shared this to say that there are people in long-term recovery, and quite frankly, I know that perhaps some of you that are on our webinar today may yourself be in long-term recovery. I'm a person that's in long-term recovery of 30 years, but they also could be your family member. They also could be your doctor, your dentist, your lawyer. I guess I share that to say that folks that are in long-term recovery walk and talk in our communities and are doing fabulously well. District attorneys, council people. As I mentioned, I was a person that was on our local school board. And so we get involved in politics, and we get involved in wanting to make a difference in our communities. And so you'd just be surprised who may be persons with lived experience around your table. So, in this, even our former drug czar, who was director of ONDCP, I like to just, he talks about I'm 1 in 23 million Americans in recovery who have gone on to live productive lives. And he was, held a position in our United States where that was very, very important. He was our drug czar. And just to have him come forward really talks about and says a lot about the recovery movement. And more of us are really trying to establish that recovery out loud, to illustrate that recovery not only works, but recovery is probable. There is data that talks about individuals who are in long-term recovery. If they get to the 5-year long-term recovery threshold, they have an 85% chance of maintaining that long-term recovery. And so that's just very important information and data that we need to have. I also like to share that, more and more we're learning from our celebrities, how they have walked the walk and talked the talk in terms of their own struggle. And so they've talked about being immersed with an addiction and talking about also about being in recovery. And I think that, when we can hear from our celebrities that they have gone through adversity, that they have been able to maintain long-term recovery, it just really makes an impactful statement that others can come forward, right? And so I just want to reiterate Faces and Voices of Recovery is an organization that does a lot around recovery. They have a lot of information about community involvement and community engagement. And then the other thing, just to kind of mention that, oftentimes when we have a visual, if I was to ask you, if you can share with me what someone looks like that might have a substance use disorder or might have an addiction, we tend to outline and identify someone who may be not well kept. Sometimes those cues, like they're living under a bridge, clutching to a bottle, it's depicted based on what our media shares with us, right? So I share that to say oftentimes we don't have necessarily a positive view on that. We tend to think that they are part of our dredges of society. And maybe we don't want to even contend with somebody who might be homeless and needing, drugs to get along through their day. And so we try to stay away from them. But I just imagine a world whereby we stop and think that could change for them if we were able to provide access to treatment. And then what happens is when we access treatment, the lives that can change. And so, I was to ask you, what does a person in recovery look like? It looks like you, it looks like me, it looks like, any one of us. And the difference about addiction and recovery is that 9 times out of 10, you could probably look and tell when somebody's having issues and struggles with addiction versus someone who isn't, just because they've changed the quality of their life. And it shows up in every facet. It shows up physically, mentally, spiritually, and just shows up on a whole different schematic, to the point where they're able to be collaborative partners. I'm just gonna kind of take a pause. I wanna take a drink here and try to pace myself through this. I get passionate, as you can probably tell, but I wanted to see if there was any Q&A that I could answer, Brittany.
Yeah, so Raphael asked, do you see the common goals of prevention and recovery operationalizing at the community level? Prevention prepared communities are also recovery oriented and vice versa. What vehicle can facilitate this approach? Community coalitions, or are there other platforms?
Yeah, and so I think that, I've been operating under a venue of having courageous conversations. There is a stigma, and I have that outlined as part of my challenge, but let me just kind of talk about that now because it's a great question. There is a stigma around addiction. And as it relates to the stigma around it, it is, some folks see it as a moral issue. Some people see it as an issue of choice. And to that, I respond, I don't know anyone who at the age of 8 years old or 5 years old, when someone asks them, what do they want to be when they grow up? I don't know anyone. And I challenge anyone to share with me that someone would come across and say, you know what? I want to grow up and be a drug addict. I want to be a dredge of society. I want to be able to ruin my career, my life, as well as my family and friends and anyone that comes in contact with me. That is my goal in life. That is my lot in life. I don't believe that exists. And I share that to say, when we can get beyond stigma, that it opens up a whole different worldview of conversation. And it becomes one of compassion and integrity that says, how do we work together? I think oftentimes stigma, as well as we stay in our own lane in different facets. And in this realm, we're talking about prevention and we're talking about recovery. And so prevention means we want to try and prevent something, and rightly so. But I will say also in recovery, we're also into prevention in the way of preventing returning to use, as well as we really try to share our experience, strength, and hope with others so that they understand this isn't a road for young people that you want to go down. This is something that if you can get interference and intercede now, that you can get some support and some information and some suggestions now, that let's move forward to this together so that you have the best potential to thrive. And so that's one of my goals at the end of the day that I hope folks come away with is that there is an opportunity that exists in our communities to get on the same page and have those courageous conversations. And then let's talk about some of those challenges that may stop us from moving forward in the same light, so that we can disassemble them and then make some decisions to move forward together. Because relationship building is really capacity building as far as I'm concerned. So that's a really great question. Thank you. Thank you for asking that. So in saying all that, let's then get a little bit deeper dive into then what do we mean when we say recovery. And what I will say to you is that I know that that word has meant different things to different people over the years. And you had different definitions. And so I appreciate that SAMHSA, again, Substance Abuse Mental Health Services Administration, collectively came together along with people with lived experience, as well as doctors and psychiatrists and drug and alcohol evaluators and counselors and treatment providers. And they coalesced an assemble of folks to kind of really hash out what do we mean when we talk about recovery. And so there's a definition that SAMHSA gives out that really many treatment centers and organizations have been able to embrace. And it talks about a process of change. And as you can see, the word change is in red, because that's really truly what it means. It's a change through which individuals improve their well-being through health, through self-directed life, where they really do strive to reach their full potential. And that change process comes from the way of wanting to be better and then wanting to do better. It is about getting some information. There's information about the disease of addiction being a brain disease. And much like, if someone has a condition of a heart disease or diabetes, there are certain things that you have to do to maintain wellness, and recovery is no different. And so it's that process in which people work through. I was on a radio call earlier today when they actually interviewed me for about 15 minutes talking about treatment and recovery. And one of the things that we say is recovery is not an event, it's a process, right? It's not an event where somebody goes to treatment and they're well. They don't have to do anything else, but it's a process. It's a process of change, which means they have to improve themselves through, just redirecting their life with purpose. And that includes giving back. That includes getting involved in the community. And so we're going to talk about this a little bit more. And when we talk about that transformation, we're talking about several different things here, which includes a powerful shift of emotion and spiritual experience. So it talks about surrendering guilt and shame of past actions. Oftentimes people realize the harm that they've done to themselves, as well as to their family members and even the community. And then what happens is that their guilt and shame really can kind of keep them embodied in continuing to do the same harmful behavior. But this transformation is about surrendering that guilt and shame to get through their past actions, right? And that they acknowledge that there's hope, that one day at a time, there's hope to be better, that they find solutions, right? Sometimes, individuals who have a substance use disorder kind of go down that spinning wheel, if you will, and just kind of marinate themselves in problems and not find solutions. Recovery is the opposite. Recovery is about finding the solution and living out that solution in a manner that is conducive to positive living. Also, a sense of belonging and connection to others. We all know, no matter who we are, that we need other folks for support. We need people in our lives. That's part of our spiritual existence, is to rely on others, to have individuals in our lives that can give us support and love. And it's no different in terms of this powerful transformation in the realm of recovery. And then through those things, they find their purposeful existence. And in that purposeful existence, they work through to make sure that they are not doing any harm to themselves or to others, and that they're having an opportunity to be of value and be of help into their community. SAMHSA, as I mentioned to you earlier, when they came up with the definition of recovery, they also then talked about the 10 guiding principles of recovery. And again, you can see them here on the screen. This presentation, as Brittany explained to you, will be available to you after today. But in the terms of just looking at these guiding principles, and let's kind of just think about them for a minute, aren't these all, can't we all kind of think about in the way of prevention, how they can resonate, not only in recovery, but prevention as well? Isn't there hope in prevention, that there's change in our community, that through our hard efforts, through our work, that we have changed the communities for the better, that we have changed the face of our community, and we have taken through environmental strategies that there is a reduction in substance use and misuse among our young people? And then sometimes it is purpose driven. We want to make sure that we are targeting the right audience in terms of making that change happen. And we know through the different pathways in the way of the different strategies, how it all can come together in a holistic manner. We need others, and through that capacity building, that's where the peer support comes in. And then it's relational. It's about building trust in our coalitions, that we all are working on the same goal. And we do that understanding that culture is relevant, that we want to make sure that we have the right people at the table that are representative of all of our community, the communities that sometimes are within communities. Are they at the table in terms of our guiding principles? And that along the way in prevention, and we know lately there's been a lot of information as it relates to prevention and trauma. And are we addressing trauma in the way that we need to in terms of looking at ACEs, right? And then it's strengthening the responsibility of who's going to do what when, and how does that help us move forward in our commitment to drug-free communities, and that there's a mutual respect about everything that we do in the way of the strategic prevention framework, that we honor it, right? And that we give it credibility to make sure that we give dignity to each of that process. And so when we talk about these recovery principles, they also can be applied to prevention. So I'll take a break here, and this is just a reflective. If you wish to put it in the chat box, feel free to. If not, it's just a reflection. And I introduced these questions to say, maybe after hearing today's webinar, you can take it back to your coalition and begin to have some of these conversations. So is your coalition aware of the recovery community in your designated areas? And so they may show up differently. In my community, let me just share that we have a wealth of recovery in our community. We have Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Celebrate Recovery, Dharma Recovery. We have counseling, both outpatient, and we also have recovery support specialists. So there's also recovery in the way of people use exercise as part of their recovery mantra. We also have faith-based, where people are going to church and really relying on their faith to help them stay sober. So is your coalition aware of the different vast elements of recovery in your community? And do you have representation from your recovery community in your coalition that you're aware of? Again, I say sometimes in other aspects of professions, people might come to you, they may be somebody from the media at your table, but you don't know that they're in long-term recovery, but through these open dialogues, it may come forth that there is a representation from your recovery community, or even, I will say, just akin to recovery. So you may have someone who has a loved one who's in recovery. And so that, just in the way of having that knowledge, is there representation at your coalition? And so these are just kind of self-reflective questions. I did see a question and answer pop up, and Brittany, I'm wondering, as I take a sip of water, is there another question?
No, it's just somebody commented, they have representation from the recovery community on their coalition as well, and they're working closely with it. And I'm seeing some other people comment that in the chat box as well.
Absolutely. Wonderful. Wonderful. And so the question then is here, how do we begin to engage for those of us that don't have the recovery community? How do we begin to engage the recovery community that they may have knowledge of our coalition's existence, and then with that knowledge have an interest in working side by side at our table to make meaningful change in our community? And so we need to sometimes, again, as we do our own community assessment, and we take a look at the composition of our communities, do we assess the existence of recovery community in our area? And that's talking about, sometimes there's communities within communities that we need to examine, and how plentiful are they? Again, when I talk about the population of recovery community in different communities, it can be really pretty large. In our community, we have a population of about 400,000 people. And what we know through different data, because of the treatment that we provide, is that at least 35,000 people are in long-term recovery. That's for us is a significant population that we make sure at our opioid task force, our opioid coalition, that there is somebody in the recovery community at our table. And we have actually several that are part of the opioid coalition. And then moving forward, how do we begin to establish rapport with and among groups within the recovery community? And I share that to say, it's not just about, hey, we know that there is a 12-step help group over across the street. Let's wait till somebody come out. We know that we have to be willing to establish those relationships. And how do we begin to go about establishing those relationships can become very, very important and very, very critical. And then do we begin to extend an invitation to attend the coalition meeting? How do we go about doing that? Letting them know what's in it for them. We always want to have a conversation with individuals that we come together so that people can identify what their role is at the coalition table. How and why are they there? Identify the role that the community recovery community can serve, and then how are they part of that prevention planning and strategy? Well, there's several strategies that I'm going to identify for you that we're doing here in our community, in hopes that some of that information that you hear you can think about when you go back into your community and do some work. And then how do we collaborate on the efforts to create community impact change? Because after, folks want to be able to know that they made a significant contribution to decreasing the likelihood of young people engaging in problem behaviors, and that they made a significant contribution to actually lowering the onset of use, as well as young people using different substances. And so here I just kind of talking about, this is from the Recovery Research Institute, where it talks about different treatments that are available in communities. And these are just some of them. There are many more, as I mentioned, but in your communities, it's an opportunity when we talk about communities within a community to be able to identify and check off, are there recovery residences? In our community, they were called recovery housing. And so do they exist in your community, whereby there are folks, again, that are with lived experience that perhaps you can make an appointment with to kind of talk about with their leadership about the work that you're doing in your coalition. There's also recovery community centers, and these are centers whereby they have opportunity for trainings and events, and maybe house some recovery meetings and support groups. Recovery community centers are usually operating throughout the day, maybe 8 to 5 or 10 to 6 or something of that nature, but they usually have different trainings and activities that are within those centers, all in the promotion of recovery and wellness, right? There are peer-based recovery supports, and these are maybe like your certified recovery specialist that will provide a service for individuals that are going into treatment or just coming out of treatment. It just really needs some strong support as they acclimate to that transitional life renewed. Faith-based recovery support, again, going, there's churches, but there's also recovery, celebrating recovery, which is faith-based in nature. Again, those self-help groups are in our communities, and it's just identifying these that maybe as you look at them, you can maybe kind of check off to see if they're in your community through further investigation after today's webinar. Medication-assisted treatment. I know that there has been some conversation, some concern with medication-assisted treatment. Sometimes individuals, even within the recovery community, consider medication-assisted treatment as substituting one drug from another. And SAMHSA has done a lot of work around, educating and raising awareness around medication-assisted treatment. It is considered to be treatment. And what SAMHSA really does qualify is to say medication-assisted treatment in combination with therapy is the best realm of helping individuals with their addiction to, usually it's opioids, but there's also medication-assisted treatment around alcohol as well. And so that's, again, another pathway. And then there's also relapse prevention. Again, looking at ways in which people can identify their triggers and so that they're less likely to engage in problem behavior. 12-step facilitation is usually your Alcoholics Anonymous or Narcotics Anonymous. And then we know that the addiction, addiction is a family disease, and that we oftentimes encourage not just the individual who has the substance use disorder to get help and treatment, but also family members need to get their own form of treatment as well, so that they're less likely to enable the individual and to, again, heal as a family. And so there's behavioral couples therapy also. So these are just some of the different mechanisms to recovery that might be in your communities that you can, as part of that coalition capacity building, investigate. And so breaking these down, extending that invitation to attend a coalition, how do you go about doing that? Maybe sharing with them the work that you do. I often found that when I'm talking about coalition work, folks are really invested and really happy that work of this caliber is happening in communities. And then the invitation can come with, if you're interested, we have meetings on this day at this time. I encourage you to kind of think about maybe coming to hear what we're all about. And maybe it's not, and you can ask your coalition, the individual may not want to join right away, but maybe it might take, a couple of meetings for them to come to before they make an informed decision. And just having that understanding can really kind of make it not so challenging for that person to say yes or no right away without understanding the full dynamics of the purpose of the coalition. And then as you involve the recovery community in prevention planning, is to understand that there's meaningful engagement, and then there's different ways that meaningful engagement can come to life. Plain language sometimes is needed. And I share this because in working with young people, we want to encourage young people to become part of our problem solving and come to coalition tables, is that we try to remember who our audience is as we're coming into meetings, and the plainer the language, the better. I know oftentimes we get into evidence-based approaches and practices, and we use academic language that can be actually, if folks don't understand what you're saying and we don't take the time to translate that, then it kind of puts they're not trying to allow me to be part of that. They're trying to keep me away, and language is part of that happens. Information sharing as much information as possible. When we can do that, then transparency really just kind of lights up itself. The more shared information we can provide at our coalition meetings, the more coalition members feel a part of the process. And then the dialogue, I often talk about the dialogue before the meeting, during the meeting, and after the meeting, can be very, very helpful. And then how do we come across in terms of genuineness? and our attitude and behavior, which can reflect then how active are we listening to hear the response from others. So the recovery community may very well bring to us valuable information that the coalition may want to consider. And then ultimately it all leads to just positive relationship building. And also it gives the recovery community the onus to see that they have a place at the table and that the coalition is inviting them to that table. What roles can members from the recovery community play on your coalition? They could become key informants. This is a tricky one in terms of where substance is being used and by whom. They can become key informants based on their own experience, right? They also can become guest speakers in terms of oftentimes, and we get this in our community, that there are schools or colleges that want to have a forum about substance use and misuse, and they usually want someone in recovery to kind of talk about what we call their experience, strength, and hope. They serve as very good guest speakers in terms of relaying appropriate information. They can become educators on the effects and harms and consequences of substance use and misuse in terms of what's happening in a young person's life, maybe how the young person might be sneaking their use, what they're camouflaging through, using different materials and those kind of things. So educating the coalition on what's happening with young people and how they're using substances. They can help advocate for legislation. We celebrate Recovery Month here in Pennsylvania, and one of the days in September, we all choose to go to Harrisburg and talk with our representatives about the importance of funding available for treatment and recovery. And so we have opportunity to provide information for our representatives that make them informed individuals when talking about legislation. They could become a panel member, and not just a panel member when we talk about guest speaker or key informant, but even panel member as it relates to talking with your local council folks about the importance of prevention. They can help write op-eds for local newspapers on the importance of prevention, as well as develop and implement programs and projects. And so there is a plethora of activities and opportunities that are there for the recovery community that can serve on your coalition. There's also, I broke some of these down, and based on my own experience that we've done in our community, there's a group of us that often afford ourselves or avail ourselves to our local schools to do some mentoring. So sometimes our principals will call us and say, we have someone who, we caught smoking in the bathroom. They were smoking marijuana in the bathroom, and can you just kind of come and talk with them? And so they provide a space for us to do that. And we just really tried to develop a relationship or rapport with that young person. Oftentimes I share with communities that when we can engage young people into positive activities and positive outlooks and behaviors, they're less likely to become problems and dredges in our communities. They're less likely to be arrested and locked up and then become part of the system, if you will. And so mentoring we know through research the value of mentoring. And oftentimes that we might be that one shining light of what a positive adult looks like in the eyes of a young person. So mentoring can be very valuable. We also engage in neighborhood cleanup and block parties, whereby back to school, we usually collect book bags for young people. And so we have young people who might have some financial challenges in their families and not necessarily have the tools to get back to school the next day. In August, the last week in August, we usually do a neighborhood cleanup. We'll identify a neighborhood that we want to clean up. And during that time, we'll also have a local DJ and we give out book bags. And it's just a really nice, neat opportunity to give back. And we usually get families looking forward to that. Where is the block party going to be this year? And it's just really a good feeling that we provide to the community. Other community connections can be, anything from giving out food for turkeys, Thanksgiving turkey dinners, Christmas turkey dinners. Again, several of us get together and we do that every year in the spirit of working with local stores and then coming out of our own pocket, but really just we give back in those meaningful ways. And that we do is part of just our own responsibility for making sure that our community is in a better place when we leave it, right? Holiday celebrations for the community, Easter egg hunts we do in April for our young people. We give them baskets. And then we also do advocacy. And advocacy doesn't necessarily just have to happen at the federal level, but it can also happen at the local level as well. And so when our local council people are making some decisions and if there's opportunity for funding to be received, how do we advocate to make sure that the dollars are being invested in a smart and healthy way, and that they ultimately impact our communities for the better, which then helps our young people grow in an environment that is healthy, happy, and drug-free. Other strategies in our opioid coalition, we have used these strategies that we have found to be very, very helpful. We have a data committee that gives us feedback on how things are going as a result of some of the things that we've implemented. But these are some of the strategies we've been able to do as part of our coalition. We've used people in recovery. We have a SOSBurks.org has a website, and in that website, there is a video collection of people in long-term recovery talking about stigma and addiction, with the hope of educating the community about stigma so that folks will look at recovery, or I'm sorry, addiction as a disease, and that recovery is possible, that people can enter into treatment and do get well. We are training first responders about substance use disorders and recovery. Again, we know that first responders are the frontline people that are out in our community and perhaps are reviving folks through Narcan. And we want first responders to know that the work that they're doing does not go unnoticed and that they are making a difference. We've been able to provide a hotline to individuals that are seeking treatment, not just at the local level, but also at the state level as well. There's a hotline that people can reach out, and we make that available to the community. Provide immediate treatment, access to overdose survivors, to detox. So there is a Blue Cares, which is an opportunity whereby we collaborate with our law enforcement to go visit an overdose survivor to let them know that we're glad that you're okay and that you're safe. But we also want to afford you this opportunity to go to treatment. And so we have direct lines, direct access to our local inpatient treatment providers, as well as our emergency, to evaluate the person's suitableness for, do they need detox or can they come into treatment? And it is one way that the individual is not inundated with putting them on hold, having them leave a voicemail, but they get immediate access to that treatment. We are providing scholarships for people who want to receive certified recovery specialist training. These are folks that have lived experience, and through that training, through the Pennsylvania Certification Board, they become certified to be able to become support specialists for individuals that are in early recovery. We've done stigma reduction through billboards, using local residents, talking about their long-term recovery. And then also, as a workforce investment, we encourage treatment centers to hire those recently trained CR certified recovery specialists into the realm of helping others right away. And hiring them almost immediately once they're trained through certified recovery specialists. So these are just some strategies that we've been able to implement and use the recovery community, and it's been very, very helpful. And then at the end of the day, what we know is that we all want drug-free communities, no matter who we are, no matter where we live. And I just can't emphasize enough the value that the recovery community can bring to make those drug-free communities happen. So I've kind of talked to you about how our coalition has benefited from having representation of the recovery community. Can you think of other ways that your coalition can benefit from having representation of the recovery community? And I share that to say there is a challenge. I know that sometimes if we're having this courageous conversation, we have to consider these challenges among our coalition members, and that is the history. As I mentioned earlier, we know that the history of prevention, treatment, and recovery are oftentimes in their own silos. And so with that history, is there an opportunity to disassemble the notions that each play yard is separate, and how can we converge those play yards to come together in the spirit of collaboration? But we have to be willing to talk about those challenges in order to break down those barriers. And again, I mentioned stigma. We know that stigma has its place and has had its place in our communities for a number of years around addiction, around it being a moral value or a choice. And so having to understand that addiction is a brain disease, it's a disease of the mind, body, and spirit, and that treatment is available and that recovery is possible. When we can work through stigma and realize that recovery is possible, we can begin to then emerge with an honest intent to embrace the recovery community. Language, how we show up, how language shows up in those conversations. There's been a movement to change the language. And so we don't talk about, and you don't hear me, I don't say I'm an addict, but I say I'm a person in long-term recovery and what that means for me. Because when we talk about addict, oftentimes we again stigmatize them with the language, because when you talk about addict, there is a certain idea about that person that perhaps germinates in the mind. But if you say that they're a person in long-term recovery, it germinates something entirely different, that they've moved beyond that shame. They've moved beyond that, that element of being a hinder to society and are now being of value to society. The other thing that I need to talk about that we haven't mentioned is anonymity. And so when you're talking about, self-help groups, many of them are trenched in anonymity. And it talks about that in its guidelines and in its principles, that anonymity is the spiritual foundation of their practices and principles. And so oftentimes it's then forwarded by, when you're in a meeting, what you say here stays here through anonymity, who you see here stays here. And we're working to change what anonymity actually means as it relates to recovery. Because I can, as an individual, indicate that I'm a person in long-term recovery. I don't necessarily talk about the maintenance of my recovery in terms of going into 12-step support group meetings, but I can talk about my life being long-term recovery and what that means for me in terms of a change agent. And so we have to do some work around anonymity within the recovery community, but that can be a challenge in terms of when you're trying to embrace the recovery community to come to the table. Anonymity may preclude someone from saying, I'm in recovery at all. And so that sometimes can be a challenge to the collaboration. And then we have to also honor that reoccurrence or return to use can happen for someone that's in long-term recovery. And then the question becomes, how does the coalition respond to that? And it could be something as simple as, we honor and acknowledge that reoccurrence can happen and bring you back welcome back to the coalition. But again, it's just a challenge that I bring up because I think it's important that the individuals understand that it can be part of someone's journey. It could be part of someone's recovery, and that reoccurrence may happen. No different than anyone who suffers from diabetes or high blood pressure. They can have a reoccurrence, and it's no different. So we have to look at it. It's a medical disease in that spirit. I'm going to take another sip of water. I think there was another question. I just want to check if there's any questions, Brittany, or responses.
Yeah, I think Jessica's question here really ties in nicely. She asked, do you have any advice on that stigma reduction in law enforcement community? In small communities like ours, when they see the same people time and again, or having to bring them back again with Narcan again and again, they seem to have a much harder time seeing the addiction as a disease versus a choice.
Yeah. So that's a great question. There's a couple things I can respond to that. Number one, I can't say enough about information and education. I had a conversation with our chief of emergency medical, our EMT department just yesterday. Now he's been in business for a long, long time. And so he told me, you know what, Yvonne, I've seen people, I've brought them back time and time from Narcan, and I would see them. And, you know, there's several instances where he's revived the same person more than once in the same day. And he said, you know, that can weigh on you. That can weigh on you from a purpose of, why do I do this? But what he's learned is through conversations, through training and education, is that the disease of addiction is a medical disease. It's a disease of the brain. And once he understood that, it changed his projection in terms of how he looked at that. So I share with you that trainings can be very, very helpful. Conversations about the disease of addiction can be very, very helpful. And then the other thing that we're doing is also doing a video training by law enforcement and first responders for law enforcement and first responders. In our community, we recognize we have some friends of the work that we do in terms of understanding that addiction is a disease that includes reoccurrence time and time again, perhaps sometimes by the same person. But we also know that we have some friends that understand that. And so we have them actually doing the video training to their colleagues to say, the life that we save can happen at any time, and aren't they worth it? Basically would be the message. So that's the other thing that we're doing. We're pulling together resources. Our district attorney is very, very supportive of our efforts and is actually taking some forfeiture monies and putting it back into the community so that we can make those type of videos happen. And I will even say, you know, even in the smallest communities, you change one mind, and then as you change that mind of that officer, ask them to work with others, ask them to work with their colleagues to also change the mind about the disease of addiction. How communities look at addiction can really make a difference in the way of that service, that deliverable of service, of whether they are looking at Narcan as an opportunity for people to get well versus, you know, why are we even doing this? And so that's a really, really, really good question. And I share this to say this, our coalition has been looking at the opioid crisis for 5 years, and we're now just getting to doing these videos. And so there's work that we know we have to do constant and often. And so I just say, don't give up. You might take several conversations, but the conversations need to happen. The courageous conversations need to happen. Is there another question?
Yeah, there is. And I wanted to specifically ask this one now and not at the end. Somebody had asked, it would be helpful for them to understand why the word relapse is not used if it's not a good word choice moving forward.
Okay, that's great. I'm loving this. So, and this is something, Brittany, maybe we could just kind of, we'll do another time just talking about language and stigma, really. And if I ask you to think about this, and so if I say, for the individual that is in recovery, and when they say they relapse, there's a certain level of shame that comes with that, because relapse is kind of a negative terminology for individuals in recovery. There's shame that comes with that. There is, you know, they begin to beat themselves up. They're less likely to even share that they relapse. But if there's a return, and the other thing is when you talk about relapse, there's the notion that it's happened over a long period of time. So the person's relapsed and they probably relapsed for several weeks, versus if you say there's a reoccurrence, it can be an isolated incident where the individual returned to use for an isolated period of time, maybe just a day, or maybe just even in that their slip was an hour. And so it breathes a different connotation to it. If I had a reoccurrence, the reoccurrence might have just been isolated, and I was able to then re-engage right away into my recovery versus relapse. And there's hope associated with reoccurrence. So it reoccurred, but there's hope associated with it. Or a return to use momentarily, but there's an opportunity for hope that I will get back on the train of recovery. So that's just kind of, as we're looking at terminology, we're looking at stigma. Stigma and language really do go hand in hand because of the previous perceptions when you talk about addict, when you say the word addict, previous perceptions when you talk about relapse, they're usually in a negative connotation. And so we work to change that language to talk about being in long-term recovery and having a reoccurrence as being something that people can do something about them. There is hope afterwards, after those terminologies. Excellent, excellent question. I hope that helps. Okay, so I just have a couple thoughts as we go forward with our day. And I really like this, and it talks about humanity, and isn't at the end of the day, we're all after becoming stronger as individuals and as a community, right? And so it talks about the bond of our common humanity is stronger than the divisiveness of our fear and prejudices. Basically, when we can break down our fears, right? When we can break down our prejudices and work together with a common bond, there is hope and promise, and God gives us that capacity for choice. We can choose to alleviate suffering, we can choose to work together for peace, and we can make these changes, and we must. For the sake of our young people, for the sake of our communities, when we can disassemble our differences and bridge hope together, we come together united for drug-free communities. So I just kind of wanted to share those parting thoughts and really underscore, I'm hoping, why it's important that we begin to take a look at who our communities are. Is there an opportunity within the recovery community to engage them and have them join us in our work for prevention? And if so, how do we go about that in a way that is beneficial for the overall working of our communities to be well? I'm done. I think we have about 15 more minutes to go. If there are any other questions or comments, I'd love to hear them. I love talking about this, as you probably can tell. And so I just thank you everyone for being here with us this afternoon. As I mentioned, I'll make sure that Brittany gets this presentation for your own personal review and absorption later on.
Yeah, so Sarah had asked, what are your thoughts on the idea that if a young person in long-term recovery presents to a group of students, the students may get a false idea of being able to use, but they will be okay and recover?
Yeah, that's a really good question. And so there's a couple things that I think about that is the young person, what are they going to say? Because sometimes when we ask people to come and share their lived experience, and particularly when schools do this, they really try to get someone that has the ability to speak about really the beatitudes of recovery. We don't dismiss what happened because we all have that knowledge that, you know, I used substances, and when I used substances, there became problems and consequences in my life. And those consequences, you know, might have included emergency room, jail, and court, and all those other things. And so we want to really talk about recovery. And so sometimes young people that are in early recovery don't necessarily have that benefit of long lived experience. And so if you find someone, if you're looking to get a young person, I would say, think about someone who perhaps is in college, right? So they were at a young person, they were younger, they were in teens. And I've worked with young people who were 16 and 17 years old. They, you know, had a substance use disorder. They went to treatment and now they're in recovery, but they're in college now. So they're juniors and sophomores. And so young people are able to see, you know what, they were at risk of dropping out of school, or maybe they were even expelled out of school But then they re-engaged in the educational process, and now they're even in college, and now they're even trying to go to work in the field. And so it's just about, and then grooming them to make sure that there's message that you want them to share is the message that understanding what is it that you want to deliver the message. What's the message that you want to have delivered, making sure that they're able to do that. So we're gonna have to do some interviewing with them to get to that.
Excellent. Sandy had asked, are there any funded DFC-like coalitions that incorporate lifespan prevention that includes harm reduction, recovery, and transformation?
So there is in Philadelphia, there is, and I can't remember the name of the group, but I know in South Philadelphia there is, and I know that because I've worked with them just in terms of looking at capacity building. And actually their coalition leader is, he's part of transformations. He's part of like recovery and treatment. So, but yes.
And somebody had asked if you could go back to the previous slide so they could see that quote again, because there were a lot of comments that they really liked that. And they wanted to see who was the author of that quote.
Absolutely.
It's a little hard to see. Is that?
It's James Earl Carter, Jr.
Thank you. Oh, thank you. And Astra typed it into the chat box there for people so they don't have to get really close to the screen.
Yep, I'll leave. And I think if we leave this here, I mean, I just, when I saw this, it was the aha moment that was just kind of, it just makes sense on every level, and I love it.
Yeah. When you had been talking about using the word of relapse, Sandy shared, Carlo Di Clemente, I hope I said that last name right, calls relapse excessive approximations of recovery. As a person in recovery, I really like that way of putting it. Thank you.
Great, wonderful. And there was, so we've come, and when I say we, I'm talking about the recovery movement has really come a long way in the way of talking about language. Because when people would talk about relapse, there is the notion that everything else is now falling out of whack. Now they're not, they've lost their home, they've lost their job, they've lost, it's just a total loss. And that's not necessarily what happens during relapse, which is another reason why we kind of really tried to work to change that language. So I'm glad that that's helpful.
Yeah, absolutely. Thank you. There aren't any other questions in the Q&A box, but I'll give folks just a minute if they have anything else that they want to ask. But while folks are doing that, I've also put in the chat box the link to the evaluation survey that you can take. And as I mentioned, once you complete that evaluation, you will be able to download your certificate of attendance that gives you the credit hours for today's webinar. If you watched it live, that certificate will be available to you. Make sure you download it before you leave the evaluation page. You won't be able to get it back if you don't download it from that page. But I'm not seeing any other questions come through the Q&A box or through the chat box. So if there's anything else you want to share, Yvonne, I think this has been a great webinar, and thank you so much for sharing your time and your knowledge with us today.
Oh, thank you so much, Brittany. I really, again, as you probably can tell, this is just a passion of mine. And I just believe that there is an opportunity that exists in all our communities to really bridge the pathway of prevention and recovery to really make an impact for change in our communities. And I hope that if anything I've resonated was beneficial for you all. And I thank you for taking time out of your busy schedules to joining us today.
All right, thank you so much, everyone. And if you're interested, our next upcoming webinar is going to be in March. It's going to be with another one of our CADCA trainers, Rick Collins. He will be presenting on working with the local government through your strategic prevention framework and incorporating them at all levels. So we hope to see you there. I saw somebody ask about the emailing the evaluation link. Yes, that will come out in a follow-up email. But we hope to see you in March at our next webinar Wednesday. Have a great day, everyone.